Hey everybody, Ligiana Anza here. Thanks for checking in again. I have to send my apologies for the radio silence the last, almost week now. My father was in the hospital having open heart surgery, and he's okay, thank God. Today is Monday again. He's still in the hospital in the step-down unit, which is a step down from the intensive care unit. Thank you to everyone who sent their well wishes, thoughts, and prayers to our family. He's doing well, thank God. This prompted me while I was visiting my dad to start thinking about what would happen if my dad didn't have major medical insurance. More importantly, if about 10 years ago I hadn't made my dad buy a critical care policy, which covers things like heart attack, coma, stroke, paralysis, end-stage kidney failure, major human organ transplants, coronary artery bypass surgery, third-degree burns, things like that. Luckily, 10 years ago even, I knew that we have a serious family history of heart disease, which of course can lead to stroke, heart attack, all sorts of other things, all related to the heart. That just, steps down, trickles down, and goes to other major organs. So 10 years ago, my dad bought a critical care policy that would cover the diagnosis and different treatments related to having what he had done just these last few days. So he had open heart surgery. He was in the intensive care unit. Thank God everything went very well, as planned, better than planned as a matter of fact. It was supposed to be a 5-hour surgery. He was out within 3 hours, which was phenomenal, the doctor said. He was in the intensive care unit for the 1 to 2 days that they expected him to be there for, and now he's in the step-down unit going through rehab, walking and learning how to cough again so he doesn't, bust any stitches or hurt himself since he had his ribs cracked open. So he's in there for a few days now, and will probably be in there for the rest of the week. And because of something that I did 10 years ago, sell him this critical care policy, he won't have to worry about any experimental treatments that may not be covered through his major medical insurance that his nurses and doctors say that he might need. He won't have to worry about his copays, his daily hospital inpatient stay copay, which if you look at your insurance policy, you'll see that it's probably about $400 a day. And if you recall my last video, 64% of the working American population can't afford a $400 emergency. So thank God my dad doesn't have to worry about his $400 per day for the maximum of the 5 days copay that he has, because he's got this critical care policy. It also will cover a very large benefit for being in the intensive care unit, as well as the step-down unit, and any additional and some additional doctor's visits, nurse visits to his house when he is released and discharged from the hospital and goes back home to start getting well on his own, and begins that long and hard 4 to 12 week process of just recovering and getting better, so that if he can go back to work, he does go back to work. Unfortunately, I don't think my dad can go back to work. Thank God I had my wits to do 10 years ago was sell my dad a disability policy. He could still work. He could still do a couple of things here and there. He could sit at an office and answer the phone, and he could, of course, sit at a computer and type some things, but I don't think anyone would ever hire him for that, seeing as how many of you know me. We're from Brazil. My dad's English. He understands very well. He speaks very well, but as far as sitting at an office and, day-to-day activities, whether it's on the phone or on a computer, I'm not sure he'd be the best candidate for anyone to hire to do that kind of work. So my dad, being unable to do his job for the 4 to 12 weeks of his recovery, will receive up to 66% of his income from when he signed up for his policy to help him stay at home and not have to worry about the bills. Thank God. And then after the 4 to 12 weeks, once he is discharged and released from the more critical care or attention of a doctor, if he can go back to what he does, which is a maintenance man / property manager at a school, which I don't think he'll be able to do because it is pretty strenuous, and my dad's already in his early 60s. He's not old, but he's not in his 30s or 40s. He's no spring chicken anymore. That job probably isn't for him anymore. So his disability policy will pay him for up to 2 years that he's out of work, and then he'll be nearing the point of Social Security disability, and hopefully he'll qualify for that at that point. Thanks for checking in, guys. I really appreciate it. Hopefully this is a lesson to everyone that disability insurance, and if you know that you have family history of something a little more serious, please just cover yourself against that stuff. My dad is the guy who, never wanted to deal with it because he knew somehow that he would never get hurt, and he would never get sick, even though we have family history out the wazoo of all the heart things and all the cancer things. So he bought the policy. My mom made him buy it many moons ago, and he's getting a little bit older, not making as much money, but thank God we were able to help him pay for those policies. So financially, he's taken care of. Emotionally and all that other stuff, that's up to him, and hopefully he recovers very well and very quickly and smoothly, and I'll keep you guys updated. Also, follow up on tomorrow's video on my story of what happened with me in the last couple of days. It wasn't just my dad, it was me as well. So thanks for checking in, everyone. Have a great day. See you soon.